Good evening, Panther Nation. Welcome to our Return to Campus this fall Town Hall meeting. I'm Jolene Butts-Freeman. I'm the Director of News and Media Relations here at Clark Atlanta University. And this afternoon's Town Hall has been coordinated to share valuable information with you about returning to campus in the fall, in addition to discuss information about COVID vaccinations and their importance to the entire CAU and Atlanta University Center community. And we have a special group of experts who are joining us this afternoon, and I'd like to go ahead and move forward and introduce them to you. First, we have Dr. Derek J. Robinson. Dr. Robinson, wave for us. Right. He is the Vice President and Chief Medical Officer of Blue Cross Blue Shield of Illinois. In this role, he is responsible for care management operations, clinical leadership, and strategic oversight in providing high-value healthcare to more than 8 million members. That's a lot of members. He is Vice Chairman of the Board of Trustees at Xavier University in Louisiana, the nation's leading producer of African Americans who graduate from medical school. Next, we have Dr. Michelle Nichols. Dr. Nichols, wave there for us. All right. Dr. Nichols is the Associate Professor and Medical Director at Family Medicine, Morehouse School of Medicine. Her research interests include women's health, preventative health, community engagement, and cultural sensitivity. Other research interests include health disparities, health equity, practice management, and COVID-19. She's also received several awards and honors to include the Georgia Academy of Physicians Educator of the Year Award and the Atlanta Medical Association Heritage Award. Next, we have Dr. Krista Marie Singleton. Dr. Singleton is the Senior Medical Advisor in the CDC's Office of the Associate Director for Policy and Strategy. In that role, she serves as the Senior Medical Advisor regarding planning with commercial insurer partners and physician providers for the CDC's 618 initiative, as well as collaborates with CDC divisions for the 618's evidence summaries. Dr. Singleton also served as a senior medical advisor in the CDC's Division of State and Local Readiness. Dr. Singleton, give us a wave. Thank you. Now, at this time, each of our panelists, they're going to give us some opening remarks to set the tone and to begin to give you some insight of their thoughts regarding our entire conversation. We're going to start this time with Dr. Michelle Nichols, followed by Dr. Derek Robinson, and then Dr. Krista Marie Singleton. Dr. Nichols.
Good afternoon, everyone. Hi, I'm Dr. Michelle Nichols, and I am the Medical Director for our COVID-19 Community Vaccination Program here at Morehouse School of Medicine, as well as the Associate Dean for Clinical Affairs. I also oversee our Student Health and Wellness Center, in which Dr. Laura Joseph is the Medical Director, and I oversee that program, and that includes monitoring and also providing vaccines for our students at Clark Atlanta University. So one of the things that I wanted to present to you is just the data, the importance of vaccine. I had the honor of speaking before the Senate Health, Education, and Labor and Pensions Committee on Tuesday. And one of the things that we wanted to bring out was just the importance of the vaccinations, particularly for our younger population and our young adults. As you all were aware, we had our vice president here at the institution on Friday. And one of the things that we want to do is to ensure that we keep the community safe and Clark Atlanta University and the Atlanta area very safe by getting our students vaccinated, particularly in light of the recent Delta variant that seems to have a big impact on what we're seeing now. And now we're seeing the infection rate among our younger population because many of the people who are older have been vaccinated. Georgia, and I'll let the CDC talk about that more, but Georgia's vaccination rate is still below what we want as our target. And so therefore, it's important that for our young people that we vaccinate them prior to coming so that they will be protected from this, particularly the Delta variant. I also want to say that we are here at Morehouse School of Medicine for our Student Health and Wellness Center to take care of your students. We provide not only the medical treatment for them, but we also oversee the COVID-19. If was any positivity rate, we handle that as well through our telehealth services, as well as through our in-person service, and we provide care for them. And we will have care Monday through Saturday for our students. And so we welcome the opportunity to be a part of their health and their treatment. And thank you so much for inviting me to speak. Thank you.
Thank you, Dr. Robinson.
Good evening, everyone. Again, it's a privilege to be with you today. My name is Derek Robinson, and in addition to what was described earlier, I'm also an emergency medicine physician. I have a strong HBCU pedigree, graduate of Xavier University and Howard University, but I feel at home with you all today because my wife is a 1998 graduate of CAU. So I want to thank all the faculty and staff on her behalf for all that you did to contribute to her development, and more importantly, the work that you all do for CAU students every day. This is such an important conversation that the CAU family is having this evening. And as a panel of experts, we're really privileged to have an opportunity to be a part of that. We know that the pandemic has impacted all of our lives. Undoubtedly, each of you know someone who's been impacted directly by COVID-19. And unfortunately, some of you even know individuals who have passed away. And we certainly know that it's had an incredible impact on not only every aspect of our lives and our quality of lives in our economy, but also impact on life expectancy in the United States. And so we really have some hills to climb still, even as we begin to see some glimpse of hope and begin to see things moving in the right direction. And I think we would all be in agreement that now that we're in the stage we are now, where we have highly effective vaccines that are safe, that we can use to combat and eliminate COVID-19, that if we were to have an individual die from COVID-19, it might even be classified as a preventable death. And so we certainly want to ensure that we are creating not only that really robust learning environment that CAU and its peer HBCUs are known for, but also ensuring that we're able to do so in a way that is safe and keeps both the intellectual legacy of the institution well through our faculty member and staff, as well as our learners. So thank you all for the opportunity to participate.
Thank you. Dr. Singleton.
Good afternoon, everyone. Again, it is my privilege and honor to be with you all today. I am representing the Centers for Disease Control and Prevention. I grew up here in Atlanta, and so when the opportunity to speak with, I feel like my Atlanta family, I jumped at the chance to be here with you this evening and enjoy the opportunity of being with your students on Tuesday. I am, as I mentioned, essentially from here. I was born in Chattanooga, Tennessee, but I've grown up here in Atlanta my formative years, and then could not wait to come back home to take care of my parents before my father passed away and my mother was still with us. And when she, as an 85-year-old, had the opportunity to get the vaccine, she jumped at the chance so that she could be out and start to resume her life. I'm also the mother of a 15-year-old who has been vaccinated and also had questions and concerns, but saw it eventually as a way for him to resume what he viewed as something close to normal. One of the things that we at CDC have seen, as Dr. Nichols mentioned, is that we are continuing to see communities of color not only be adversely affected from COVID-19, it is hitting our communities harder than others, but we're also seeing still low uptake levels of a very, very safe and effective vaccine. And we just published information today trying to better understand what's happening and where we can make some changes. And this opportunity tonight is a way to help get people's questions answered. We see that people are still concerned if this is a safe vaccine, and it is. All three of the options for vaccination are extremely safe. People have questions around side effects. And so again, you may have some effects, which we'll talk about. But again, comparing that with rolling the dice on getting COVID and our community being at a higher risk, we want to answer your questions so that hopefully you will make that decision to have your students be vaccinated, as well as yourselves if you have not. So I will stop there and look forward to having a conversation with you all this evening. Thank you.
Thank you. Well, I'd like to thank you all for your opening remarks. That's definitely setting the tone for our conversation this afternoon. I'm going to go ahead and just dive right into the questions. So is everybody ready? Sound like a baseball or football coach, right? Is everybody ready? But here we go. Let's start with this question. I am fully vaccinated and do not want to wear a mask any longer. What is the policy? Anyone can take that. Who would like to take that question? Dr. Nichols?
So yes, I'll take it. So people who are fully vaccinated, it is not necessary to wear masks. However, be aware that but you don't necessarily know who around you is vaccinated and who is not vaccinated. Since there is going to be the mandate that our students are vaccinated with some exceptions for various reasons, it is safe, particularly if you are outside. Now, there are areas where you still must wear a vaccine, such as when you're traveling and you're on an airplane and other type of tightly enclosed areas, but it is safe to go without your mask. But you don't necessarily know, particularly for our state, who is vaccinated and who is not, because unfortunately, there's 43% of our population in Georgia is vaccinated right now. That's the very below what our mark is. So, but overall, based on the CDC guidelines, and Dr. Single can go into that in more detail, but based on that, it is okay to not wear your mask if you are fully vaccinated, but just except there are places where it still is a requirement to wear your mask.
Yes, thank you, Dr. Nichols. That is correct, that some businesses still are opting to require masks. So I tell my colleagues, my son or my husband, we all still carry a mask with us in case there's a place where that particular business has decided to continue that requirement. As she mentioned, I'm looking at actually the current DeKalb and Fulton County statistics right now. In Fulton County, as of just this week, only 32% of Black residents in Fulton County have received one dose of the vaccine. And in DeKalb County, it's about the same, 32%. The areas where the lowest, what we call census tract, the lowest counties where there is vaccination, unfortunately, are tracking into Southwest Atlanta. So that is a bit of a concern where we have individuals who have not taken advantage of the opportunity to get the vaccine. So in those cases where there are unvaccinated people, there may be some advantages of still wearing your mask. You don't have to. That's one of the reasons why, again, my son opted to get, well, he didn't have too much choice. Mama said so, but he came and warmed to the idea because he thought, well, at least I don't have to wear a mask if I don't want to. And so those are just considerations you have. We have noticed that the flu was lower this year in the nation. And one of the reasons may have been because people were wearing masks and social distancing and washing their hands. So those are good habits. Some of those habits may keep some of the other respiratory illnesses down. But you don't have to wear one if you are fully vaccinated.
Yeah, and thank you, Dr. Singleton. I carry my mask and I put it on my wrist everywhere I go so that I can make sure that I put it on in various places that require it. And I still do feel most comfortable if I go to the grocery store and those type of places, I wear my mask. So like you said, you don't know the status of the person beside you if you're in a public arena.
And I'll just add a comment as well here that while I think we all affirm both the safety profile and the high effectiveness of the vaccines that are on the market, I think we're also humble in stating that they're not 100% effective, right? So when we talk about you don't know whether others are vaccinated, there's two pieces to that. One is the model that you set for those individuals, but more importantly, are those individuals infected, and could they have, sometime down the road, some variant that perhaps there could be some less effectiveness of the vaccine against. And so those are things to be cognizant of. And I think also as a community, we want to ensure that we're also being respectful of things that we may not know about individuals. So someone may have, for example, young children that can't be vaccinated. And so their risk profile may be a bit less tolerant of exposure, right? Or they may have a family member that has a compromised immune system or some other medical issue that might prevent them from being vaccinated. And so they may be a little bit more cautious. And so we want to ensure that, we're collegial with individuals that decide that they may want to continue to wear a mask in close settings for those safety reasons, which are totally reasonable.
Dr. Nichols, I want to ask a question. It's not on this list, but before I do that, I want all of the viewers and listeners to be sure to know that if you have any questions that you want to ask, please put those in the Q&A section there at the bottom far right side of the Zoom platform. And we're going to do our very best to get to answering those questions. But Dr. Nichols, you mentioned that we're only at 43% below the state's target. What is the overall target percentage?
So we want to try to, one of the things that we're pushing for through the Biden administration is we really want to try to get to up to 70%. We are not close. We are not anywhere close to that mark. And we want to try to get that done by the 4th of July. So the reason that we want this is that what we would like to have is something called herd immunity. And there is a certain point where you reach that. So that's why it's real important that we try to do that. In addition, since the variants are coming out now and they're very virulent, they are, and so that's something that that's why we want to vaccinate. Right now, it looks like there is protection from those variants, but when you have people who are not vaccinated among us, that increases your overall risk. And so that's why we really, really need to push for everyone to get vaccinated. Particularly in our younger age population, young adults, a lot of them have certain myths and misinformation that they are hearing. And this unfortunately is having an impact. And we really want to protect, particularly our African American community, our brown and Black communities and communities of color, because as Dr. Singleton said, we are at greater risk. Because of that greater risk, we really need to do what we can to try to protect ourselves.
Yes, thank you. I would like to add to that. As I shared with the students 2 days ago, one of the things with viruses, they're pretty sneaky and they love looking for places to go. And I use the club analogy, since trying to, young people like going to the club. So I'm wearing red today. So if the virus, let's say, is blue, but everyone at the club is in red, the virus is going to change its coat to blend in with the red people. And so Dr. Robinson, the analogy is when you go to the club, you go with certain people, you may not want to leave with other people. The virus is trying to weave its way in there and leave with you. And so by getting the vaccine, you are protecting that from changing that coat to blend in with you. These young people, as Dr. Nichols mentioned, are getting information not from health providers like us or trusted people, knowledgeable. They're getting their information from Dr. TikTok and Dr. Instagram, which may not always give them things to keep them safe. We're also noticing, and it's understandable because they are still young adults, adolescents, that their testing limits and I don't want someone telling me what to do. I should be able to do whatever I feel like doing. And I would offer the converse of that, the slight flip on that. We're asking you to get vaccinated so that you can do everything that you want to do, so that you have the freedom to be safe and be your best life, to live your best life. This vaccine is helping you get to your full education, if that's what you choose to do, or your full sports career, or your full whatever you choose to do, not being held back by 2 weeks or more in the hospital, or worse yet, dying. So that's why we really, really, really want the community get vaccinated. We need our young people because that's where the virus is hiding out right now. It's hiding out in the 18 to 35 age bracket because those folks in the club don't have that protection right now.
Sure. The next question would be, I would like to better understand the process used to develop the COVID vaccines. Dr. Singleton.
Sure. So there's been a lot of questions, and I think I saw one in here in the chat about, these vaccines appear to be developed so quickly. It's important to note that the technology that has been used for the first series of these vaccines has been around for about 30 years, particularly in the cancer population. And when the scientists at the National Institutes of Health, and in fact, a Black woman researcher, they recognized the kind of like tracking and how the virus was created, they realized, wait, this is a match for technology we already know. And so when you take already existing knowledge with something that's almost like a slam dunk, and you throw everybody's time and attention to it, it gets developed a lot faster when you've got all the pieces and parts. A plus B added up to C really quickly. The second piece that people are concerned about is that it hasn't been tested. But in order for us, the federal government, not CDC, but the whole of federal government to lean forward and for something like this, we need several months of trials and experience to say, yes, this is something we should do. And all three of these vaccines have met that mark. They were tested in communities of color. They were tested with all types of people with pre-existing conditions. They have been tested in pregnant women. We had women in the trials who became pregnant, who have had healthy babies since then. And so with all of that great information, we've leaned forward to say these are extremely safe and protected. And in areas where people have been highly vaccinated, we're noticing the case counts going down. So we want that for Atlanta. We want this for the Clark Atlanta community.
All right, our next question. No, go ahead. Go ahead,
Jolene,
Dr.
just want to add a thought here, because I think
Sure.
it's beautiful that we have Morehouse School of Medicine, for example, represented in the discussion, one of our historically Black medical schools. You know, the other piece to this is, you know, some of the distrust that we've seen, and rightfully so, both from a historical context as well as a result of some of the misinformation and disinformation that circulated around during the course of the pandemic. And certainly that plays a role. And I think it is something that we can take pride and comfort in, knowing that you've got both institutions and experts that are steeped both in their knowledge of the historical experience of our communities and our healthcare system, and to be able to approach, you know, the evaluation of the vaccines and the trials and the like, and to be able to make recommendations and provide good information to individuals who are seeking that information. So I think that's something that this community can be comfortable with and should actually be proud of.
Well, you kind of just touched on this next question, and I would agree with you 100%, Dr. Robinson. It says, why should I feel the vaccines are safe given that they were produced in such a short period of time compared to other vaccines? And then that, of course, will lead to the other question relative to vaccinations as a whole. You know, it's kind of commonplace for us to have to get vaccinations for your kids to go to school and, you know, go to college. So I remember with my children, we had to make sure their records were updated. Those are vaccinations. So if you could answer that question and then touch on the second piece, that would be amazing. And everyone else that would like to chime in.
Yeah, and I'm certainly will ask Dr. Singleton to weigh in here as well. Yes. I think one thing, if you add on to her comments earlier, we also extracted a lot of kind of red tape delay out of the review process. So marrying all those together did get us with a shorter time frame. But, you know, I would pose the question, the conversation a little differently here, given where we are from a technological perspective, and just given just how we live our lives each day. I think there's probably an expectation amongst the community that we should be able to respond to public health emergencies with due speed, right? And I think what we're seeing right now, just keep in mind, we've had 600,000 people or more in the US die from COVID-19 and millions infected. When we look at the declines in positivity rates, when we look at the declines in hospitalization and declines in death rate that we see since we have really launched into this vaccination campaign. I mean, there are a lot of really important lessons that we're learning, but I feel assured that despite the conversations we're having to address some of the lingering hesitancy and distrust, that as we move into the next, you know, public health threat, particularly from a virus or some other infective vector, I think there's going to be renewed expectation that we're able to catalyze our technology and scientific resources to respond quickly to try to mitigate that. And so I think that's sort of the flip side to, should we have been faster in terms of our ability to address some of these challenges in the past? And I think that we are learning some important lessons, both domestically and globally, regarding what we can do if we put our minds and our forces and our efforts together. And then just as a reminder, global pandemic with people dying everywhere, it serves as a really strong motivator to try to get it right and get it right as quickly as we can.
Dr. Singleton, did you want to chime in on that one?
Yeah, again, when you put money and time behind something and the entire forces that went toward it was like all in on a poker game. But again, when our global colleagues, when the virus started coming around in China and then here to the United States, the global community got together and they shared the sequence of that virus. And that's how vaccines are made. You match it, the technology with they call the sequence or the roadmap. And again, that's where our scientists, again, Dr. Kismikia at NIH saw that, wait a minute, this matches with the technology we already have here. So again, when you already have that A and the B together, and then you throw everybody's efforts to say, we're all in on focusing on this, it's no surprise that this got here as quickly as it did, not because we cut any corners. And again, all the safety processes were in line. They are still in line. When people are vaccinated, we, CDC, have 2 safety monitoring processes that identically that we use in the trials to identify any potential signals where something might need to be further investigated. And all that went through in this process.
So I just wanted to add something. The CDC has the Be Safe program, and that's a continuing monitoring process. And I think that that's something that not only did we go through all of the same rigors that we had for vaccines, we just did it faster and we use previous technology, but it's a continuous process. It doesn't just end there. So you, not with just the trials, because when people fill out that data, it asks you those questions. I did it and I think they just now stopped asking me, and I got vaccinated, finished in January. But they were sending out little things like, how are you doing? You know, smiley face. So I think that, or if there's anything going, so they're continuing to monitor even as people are getting vaccinated now. So you have now millions and millions and hundreds of millions of people with all that data added onto the trials that were already done.
All right. I'm going to jump to the Q&A section on our computer. And there's a question that I thought was interesting. It says, do you know if the vaccines are effective on people who have undergone transplant operations? Anybody can take that one.
So yes, they are safe for transplant. From the data that I've been reading, you don't know as well as because their immune system will be lower. So you're not really sure of the exact, but it does provide protection. And again, you have to look at the risks and the benefits. So the risks associated with a person who is severely immunocompromised is much, much greater if they get COVID-19. So you have to say there is extreme benefit here with them getting the vaccine. But because of their immune system, and you really have to start looking at what their immune system, they might not get as great a response as some of the other people.
Yes, absolutely. We get this question a lot, and it becomes again, do you take your chances with getting COVID? We have a lot of data on individuals who are immunosuppressed, who have organ transplants. If they get COVID, all bets might be off. I mean, they have worse outcomes. Whereas those who have been, some persons who were immunocompromised, who got the vaccine in the trials and what we're seeing in the real world data, they have not gotten sick with COVID. We still don't know how long their immunity may last, but they have been protected.
Is there any data available on the number of fully vaccinated people who have contracted the coronavirus after receiving the vaccine?
We have a little bit of data on that. Again, no vaccine, Dr. Robinson said, no vaccine is 100% effective at preventing illness. And so we do have a small percentage of people who still get COVID-19. The good thing, what we have learned and seen from those persons who have been fully vaccinated is that if they get COVID-19, they have a very more, I would say, a milder case of things, so it still may happen. In fact, I'm looking at my notes here. We've had more than 144 million people that have been fully vaccinated as of last week. We have had, let's see, 3,000 persons with COVID vaccine breakthrough infections who were in the hospital. So you take that numerator, I did a little bit of math with the students the other day. So 3,000 patients that may have had a breakthrough compared to a denominator of 144 million. That's a pretty small number.
Okay.
I would agree with Dr. Singleton. We've monitored similar data at the state level. And again, we've seen some breakthrough cases with hospitalizations and deaths, which could be associated with or not with COVID-19. But certainly when you put that on top of a denominator of the millions of people that are infected, I think it does again support the high effectiveness rate.
Okay. Is there any evidence that the vaccines alter a person's DNA?
No.
No, absolutely not.
All righty. Let's see. We'll ask this one next. Should fully vaccinated people continue? Well, that's a repetitive question. Wearing the mask, social distance. What about social distancing? Should they continue social distancing? That's a good question. We've talked about the mask, but what about keeping far away from each other and just not wearing the mask?
Well, that still is an option for people. They can still, I mean, particularly when you look at large crowds, particularly large crowds of unvaccinated people. And if you may have small children, and children under age 12 cannot get the vaccine at this time. And so in those situations, the younger children, families with those younger children who are in situations where there might be cases of individuals who are not fully vaccinated, that might be something to consider. But fully vaccinated people do not have to socially distance themselves. At least that's what our guidance is saying right now.
Okay. Do the vaccines have the same or a different effect on people of color?
The vaccines are just as effective for people of color. And just because we are at a greater risk, you have to look at the risk factors that are associated. So we are considered, so therefore, that is why it's so important that we protect ourselves. But there is no difference if you're Black or you're Black, brown, or white. The effectiveness of the vaccines are the same. They're all, the two, Pfizer and Moderna, both are above 90% effective, 94, 95%.
And I will just chime in. I agree with Dr. Nichols' statement, and we've all read a lot of this trial data. And I think even what I recall from the Pfizer trial, when they looked at the data sets for African Americans that got the vaccine and those that didn't get the vaccine, I think they had 0 symptomatic infections in African Americans that got the vaccine versus those that didn't. And that doesn't mean that as it plays out at scale that'll be the case, but I just offer that just to kind of drive home the point that Dr. Nichols noted that this data has been segmented, looking at it by gender, by age band, by race and ethnicity, by the various types of chronic medical conditions, to evaluate that effectiveness at those levels so that we can have some confidence with regard to the use of the vaccines.
I like to throw in that, and so hearing all that, we still, as a community of color, are not getting vaccinated at the same rates as these other groups. Just looking at my notes for this again, we have about race and ethnicity data for about half of the people that have gotten vaccinated, and about 9% of those who received one vaccine were Black or non-Hispanic, and these numbers are going up slowly but surely. We make up 12% of the population, but only 9% of the people being vaccinated. So there's room for us to improve those rates. And again, as Dr. Nichols and Dr. Robinson are saying, there's no biologic difference between race and ethnicity, and we have no evidence to suspect that there will be an adverse event within people of color or based upon race and ethnicity. And one of the things that CDC has pushed for is that in these tracking systems that we have for safety, Dr. Nichols mentioned the Be Safe, which is on your smartphone. So again, when you get vaccinated, you will have the opportunity to use your smartphone and get these messages sent to you. And we have a way to sort that information Does your arm hurt? Does your head hurt? Does your belly hurt? Are you tired? By race and ethnicity. And then if there's something that, that goes on longer than 24, 48 hours, and we have a vaccine adverse event monitoring system, it too has the opportunity to sort by race and ethnicity. And right now, we are still not seeing any dramatic side effect differences between the races right now, and we're still continuing to monitor it. So bottom line is that our numbers of people of color are still lower than the majority population. We have room to grow. We know you guys can do it. We can do this. And so let's get vaccinated.
All right. I'm going to take a question from the Q&A section of our Zoom platform. It says, are vaccinated people likely to need a booster shot at some point in order to protect them against more dangerous or future variants? If so, how soon do we think those will be deployed? Are they being researched and or formulated at present?
So currently, yes, there is the data. We're doing studies at this point, and there is the likelihood that we will probably will need a booster. Just like when you take the flu shot, you have to deal with the variants. We get a flu shot. It's every year that we have to take the flu shot. But right now, the data, we're still collecting data and looking to see when and at what point in time people will need to get that booster based on when they receive their vaccine.
Yes, we're looking to see people's immune levels. This Delta variant that's coming around, like, for example, it is showing high rates in Missouri. The section of Missouri where it's going, again, it's that club thing again, it's going to pockets where people are not vaccinated. So when the virus can't find a home, then it might change its code to try to find a new place. But for right now, we are confident that all three options are protective, but we may need that later on if the virus outsmarts us after we get everybody vaccinated.
Okay. So I do want to let our viewers know that all operations questions will be answered by Mrs. Hoyt, and those will be placed on the website for you to have access to review and get the answers from. We'll be sure to take the questions that you have presented to us, and we'll provide the answers for you on our website, in addition to all the other previous questions that have been submitted this evening or answered this evening. All right, we'll look for another question in the chat. I've read that one already. Let's see. That's a protocol question. There was a question about a person who's already been vaccinated, but they were concerned about their 5-year-old and the potential opportunity of passing that on to the 5-year-old. Can you give them some insight on that concern?
I think we can build on some of the comments that have been shared earlier. So one, premise is that the vaccines aren't 100% effective, but they're highly effective, right? And we do know that that 5-year-old, like my 2 children that are under the age of 12, are not eligible to be vaccinated currently. The studies that have looked at this so far suggest that the ability for individuals who are vaccinated to transmit COVID-19 is very low. I think we also have, again, adopted some humility as we've gone through this pandemic as well. And so, I'd be interested in Dr. Singleton's thoughts or Dr. Nichols' thoughts. I would say as a vaccinated parent and a household with 2 physicians that, see patients and, have some risk of exposure, we still try to be a bit cautious about our engagements and where we are in the level of protection that we exercise for ourselves, because we know that we do have individuals who are vulnerable in our household who don't have immunity from the vaccine. And we certainly want to ensure that we're making the best decisions that we can on their behalf with the information that we have available. And so what I would convey is a similar message I gave to my mother a year ago when she was trying to figure out whether she could go back to church or not. And I said, if the doctors are showing up and they're sitting in the pew, you can go. But if they're still staying at home, then it might not be the right time. And so I would just say, as a doctor, I continue to I will social distance. You won't find me in a really tight, sort of crowded area without a mask on. And, that's, those are my thoughts. Ladies, what do you think?
I tend to agree. If my son were younger, and he's an asthmatic, and I were out and about, back in clinical practice, I would probably be doing the same thing within your own household. And particularly if I were mixing us with another household, and that is in our CDC guidance that those who are vaccinated have a small likelihood, almost tiny infinitesimal amount of transmitting the virus to someone else. That being said, if you're mixing another household, so if I'm in my household here in Dunwoody, and then we're going to, let's say, middle Georgia, where the vaccination rates are lower, then we might want to wear the masks and social distance there, because regretfully, in certain parts of Georgia, if their vaccination rates aren't that high. And so that's where you have a little bit of discretion for situations like that.
And I echo everyone, and I always tell people to be, if you aren't within the same household and you don't know the status of the other individual, to be extra cautious, because there are, my children are college age, but there are people with young children, and then they have people who are immunocompromised in their families. So I just say be cautious. I also say that if you are socializing and eating out with various people who you do not know their status, you really need to practice social distancing or be outside. The reason being is because you now have your mask off while you're eating. And so you want to ensure that you are social distancing, because the vaccines are not 100%. They are, 94, 95%, but you just need to just practice those and be cautious and be cognizant of where you are, particularly when you go out into public places. And I wear my mask when I go. I went to the grocery store today and I had my mask on too. So I still practice those same guidelines as I did before.
Well, that just kind of answered the other question I was going to ask. So I'm glad you went forward with that, Dr. Nichols. So let me ask this question. And it just kind of went into my head and flew out. I guess that's an evidence of my aging. But where would you all suggest people gather their information from? Like, to stay abreast of the changes and what all is happening, as we're still in this pandemic and as people are getting their vaccinations. What is the best source? What is the best resource for us to go and get updated, actual factual information that's going to make us comfortable, with what's happening in the world?
Well, I stay on the CDC website. So, Dr. Singleton, I stay on the CDC website, but I also go to the Georgia DPH website as well. Since we are Georgians, I look at the data, I review what the dashboard looks like so I can look at the numbers. So the CDC is our expert, and they're here and they're doing the data for us. So I go there. Do not rely on, as Dr. Singleton said earlier, the TikTok and Instagram and Snapchat and everything else. We need to follow the science.
Okay. I'm going to ask this question because it makes me think about family and friends. Some friends do what they want, some family, they do what they want. Here's one for you. My friend had COVID and said that it wasn't necessary to get a COVID vaccine because her body dealt with it naturally. Should she get the vaccine or not? This sounds like a concerned friend that wants to encourage her friend to do so, but her friend seems to think, my body will deal with things naturally. They're naturalists and I'm all good.
We get this question a lot. We get it a lot.
I imagine so.
And so it is true that her friend who had COVID has some natural immunity. Here's the rub. We don't know how long that natural immunity will last. And we have had some studies that show that those who have had COVID, so for example, in my own family, my brother-in-law had COVID in November, Thanksgiving to be exact. And so he will have some initial protective immunity. It is now June, and so that's probably waning some. So we have encouraged him, and I believe he's gotten vaccinated, to get vaccinated, because we're seeing that you've had it a little bit before, you've had the vaccine, the virus, and now this gives you an extra boost, that extra protection. So her friend who's gotten the vaccine and gotten her natural immunity, I would offer to her, you're getting an extra booster shot of protection by her getting the vaccine. My colleagues may want to add to that.
Well, those great comments. And I believe we also, through some of the studies, saw that in Brazil, they had a high rate of reinfections there, which I think was also sort of instructive to us globally around kind of the strength of immunity from prior infection and how that may play out when you have additional variants at play. So certainly we want to encourage everyone to get vaccinated, even if they've been infected with COVID-19 previously.
All right, here's a question. There's a concerned effort by anti-vaccination groups such as Children's Health Defense to pressure colleges that have vaccine requirements to rescind these requirements. What are the best ways we can inform our communities that the benefits far outweigh any side effects that a few may experience? It's a very good question. What is the best way we can inform our communities that the benefits far outweigh any side effects that a few may experience?
Well, the benefits definitely outweigh any risk. We want to get our colleges, our students back to some degree of normalcy again. We have seen that our students at all levels have not done as well with the remote learning. Some people are tactile, some people really do need in person. So it's important that we give our students every benefit that they can get for through their education. And that is the way to do it. Also with our sports, another thing, our sports teams, we saw where whole teams were quarantined because someone had COVID. So they were either quarantined or isolated. So we want so that our athletes can get back to playing and doing the things that they want, so they can get the opportunities if they want to go on to the next level for professional ball. So it's important that we do this so we can open up our campuses again and that ensure that our students are safe, whether they're playing sports or they're going to class or they're going to socialize, because young adults, they socialize. They want to go out, a freshman wants to go out and have parties and do things that other people do, or upperclassmen. So we need to make sure so that you have to quarantine or isolate, have a dorm that's full with people that are quarantined or isolated. So I think that this is the way that we are able to open up our campuses so that we can ensure that our students get the benefits that they need.
All right, well, I hope that our viewers, our faculty and staff have actually found this conversation helpful. And at this time, I'm going to ask each panelist to please give us your closing remarks and just say whatever you think we need to hear and we need to know to be able to move forward with momentum here at Clark Atlanta University as we prepare to reopen in the fall. So we can start with Dr. Singleton.
Sure. And so I mentioned in my opening remarks that our communities of color regretfully have been leading the way in terms of having worse outcomes from COVID. And we would like to applaud the Clark Atlanta campus and the Morehouse School of Medicine and the associated campuses for making this key step forward to protect their communities. And it's the reverse of, well, unfortunately, our communities have been hit harder. So we're leading the way along with other colleges to really help our community get vaccinated. We support your efforts at Clark Atlanta. We applaud your efforts. We're here to support you. And for your family members and friends and faculty members that are on this call, we support you. If you still have questions, we encourage you to get your questions answered. We are here to help you get to the decisions that you need to be vaccinated, and we're here for you.
Dr. Nichols?
I just want to encourage everyone to get vaccinated. And if you are vaccinated and you have family and friends or colleagues who are not, to tell them to get vaccinated as well, because that is our best way of getting back to the way we were or somewhere close to normalcy. Things probably will never be the same, but we'll get close to that. And I do want to say, since we are basically across the street at with our Lee Street Clinic, that we are here to vaccinate. People do not need an appointment. They can come and walk across the street or walk up the street rather to get vaccinated. And there's also the opportunities wherever. The pharmacies are staying open later now. So you can go, there's no barriers at this point for people getting vaccinated. So you can go to your drugs, your pharmacy, your grocery store here at our Morehouse Healthcare Clinic, which is walking distance. It's a little farther for Clark Atlanta compared to, I guess, some of the other schools like Spelman, but we are here and we are available, and that I am available if anyone wants to call me, and I'll put my email address in the chat. So I'm there to answer any questions that people might have. And if you want to just see about getting an appointment, I have told everyone to come over. So we have vaccinated a lot of people. So thank you.
Dr. Nichols, go ahead and just give us your email address, now verbally.
So my email address is mnichols, so MNICHOLS at msm.edu, for Morehouse School of Medicine.edu. And I'll be happy to respond and make sure that you have an appointment, or if you want to walk in, just walk in. We're available every day for vaccinations.
Dr. Robinson.
Thank you, Jolene. Let me start by saying it's been a privilege to serve on this panel with Dr. Nichols and Dr. Singleton. And again, really happy to be part of this really important conversation that CAU is having. Certainly, I know that these conversations are saving lives, are making a difference. And as you all both contemplate perhaps your own decisions, or you're having conversation with your friends and family, it's important at this time for us to listen, hear what people's concerns are, talk with them about what some of the pros and cons are of the various perspectives that they have, so that we can help win the hearts and minds of individuals and get them vaccinated. Again, we not only know our personal experiences with COVID-19 and how it's impacted individuals in our family and in our communities, but we also have seen what has happened on a national level for us. We've lost over 1.8 years of life expectancy for the entire United States from 2018 to 2020. But when you look at our community, an African-American community, we've lost more than 3 years of life expectancy, hitting African-American men the hardest. So we now know that we have yet another condition that is impacting the health of our communities, and it's now preventable. And so we've got to pull out all stops to ensure that we protect the health and the economic viability of our community members and our families. And this is something that's really important. And then, as we stated earlier, it's not a genetic predisposition that's causing these higher disproportionate rates of COVID illness and death in our community. But we know that many chronic medical conditions like high blood pressure, cardiovascular disease, diabetes, obesity, and others make the course of illness much more complex and a risk of death higher. And when we look around the rooms in our families, when we look at our colleagues, when we come together, look at ourselves, folks may not have just one of those conditions. We might have a little kit, 2 or 3 or 4 of them, which elevates the risk, which again drives home the imperative of why we need to have these conversations and really move up the vaccination rates in our communities. So again, commend CAU, thank Dr. Nichols and Dr. Singleton for the leadership that they're providing there locally and nationally. And thanks again for the opportunity.
I want to thank you all for sharing this information with us this afternoon. It's been very informative, and it's definitely going to help us as we move forward with momentum to open our campuses in the fall. I also want to let our viewers know that if there's anyone or any faculty or staff member that missed this particular Zoom conversation, they can find this on our website. You guys know what it is. It's www.cau.edu. So you know exactly where to go to find this information. It will be in case you missed it graphic. So again, I want to thank all of our esteemed panelists for taking time out of your busy schedules, because I know you're busy, especially during this time, to participate in the discussion. I also want to thank our online learning and continuing education group for operating our technology. Special thanks to Eli Phillips, our Chief Operating Officer, Dr. Omar Torres, our Dean of Students and Campus Life. Thank you. Thank you to Ms. Deborah Hort, our Chief People Officer, and to Sam Burston, our Vice President of University Relations and External Affairs, and to his entire team. And of course, to our esteemed President, Dr. George T. French Jr., the amazing President of Clark Atlanta University, who's pulling out all the stops and getting it done here at CAU. But at this time, before you leave, I want you guys to check out something, a special message from President French. You don't want to miss this. And after the message, please enjoy your evening.
Hello, I'm George T. French Jr., President of Clark Atlanta University. As we continue to navigate the COVID-19 pandemic, I know there may be some hesitation to get vaccinated, but each of us must do our parts individually to maintain the collective well-being of our community. Therefore, I encourage everyone to get the vaccine. Remember, we are all in this together, so each one get it done. Vaccinate.
Thank you, everyone. Be vigilant, be safe, and have a good evening.
Thank you so much.